Good evening, everyone. I am Professor Jennifer Harrison-Hauer. This is week 2 of your pharmacology. A little snippet of a review. I'm going to get right into it. I've got a few things to share with everyone. And I actually am going to, there we go, fabulous. I'm going to delve into chapter 9. Um, all of the chapters are important, but I want to really emphasize some things here that I think will be great for you guys to be aware of, especially with an upcoming exam. Um, there's a blueprint that was given to me today, and I posted that for you and some other information as well. It may seem like overkill, but use that blueprint definitely as a guide. Um, Try to attend those concept reviews as well if you can. And let's just get right into it. Nursing, you're going to give medication. I've gave many medications today. All righty. So you want to start that foundation off correctly with getting those 6 rights embedded into your cerebellum as quickly as possible. So your 6 rights of medication administration, you want to always give the right medication, right? You want to make sure you have the right patient, the right medication, the right dose at the right time, the right route, and you want to document correctly. You want to start off your nursing career with a solid understanding of that, and you never tarry. So that means that if in the beginning it may seem like, oh my gosh, it takes forever. Yeah, because you've never done it before. But for me, or someone done it for a while, I mean, we had to grow into our nursing, but I always do my 6 rights. And if I know them, I don't, I don't, I'm focused, laser focused, because you read in the news about folks not giving right medication to different people. You don't want to be one of those people. And my license has been pristine for 3 decades. So now we're going to get into the right patient. So you're always going to ask their name. And if someone, I said, so what's your name? If you say Marlet, what is your first and last name? I need your name, not what they call you. I need your name. Oh, you know me. What is your first and last name? Soon as we get this done, you can get your pain medicine. Okay, so you verify with 2 forms of identification. Now, the VA where I work is name and last four, their social. Go by your policy. But you want to compare that patient's name, the stated name, not what they like to be called, and their birthday with the patient's ID band on their MAR. This is what they're wanting you to know for this course. All righty. You may have something else in your hand, but when you're starting out, name, date of birth, you're gonna usually be working in the hospital. Somebody has an ID band and you have their MAR. The medication administration record is what MAR stands for. You're going to scan that patient's barcode with their ID band. All righty. You're going to check the color coding on the patient's ID band because they may be color coded for meaning they're allergic to something. But it's not just a band that has their name on it. It serves many functions. If there's a family member in the room that's translating or what have you, you can use that patient as well, but you want to ask the patient their name and date of birth. Even if someone doesn't speak your native English, they know how to say their name. Okay, so check for name alerts because there are folks that have like Mary Agnes Smith, and I have a Mary Agnes this person. So you want to just double check all of that, and that's just the first one. So that's the patient. You got the right patient. Okay, check. All right. Now you want the right. I think I skipped. No, I didn't. Okay, my bad. All right, sorry. Right drug. All right. You want to give the right patient the right drug. So you're scanning the medication label. And then because that's going to help you check your order with what it's prescribed. If it's not prescribed for them, it's going to stop right there. Okay. You read the drug label 3 times And if this is all on the GCU PowerPoint, then they really want you to know this. Okay. This is not something that Professor Harrison-Hauer made up last night. I actually took this from the website, GCU. So you want to read it 3 times, not 2 times. It says 3 times. All right. Be familiar with the patient's health record. And all of that means is that if they're coming in, you want to know what their diagnosis is. Okay. All right. And you want to know a little bit about your patient before you give them the medication. So you're reading up on them in their chart, allergies, lab results, and vital signs. It seems like, oh my gosh, but giving meds should never be taken lightly, because you're the last check before that person swallows that pill. So, and people are human and they make mistakes. Not every person makes mistakes, but I have caught a many a error. So you're the person that's giving it to them. So ultimately, you are responsible. All right. Know why the patient is receiving medication. Okay. If they have a UTI, then they should be giving something for that UTI. You should be like, why am I giving them, why are they ordering insulin? I know that's like a really unusual, like me saying that, but you should know that. Oh, makes sense. And you need to question people respectfully. You want to check the dose calculations, okay, and know the beginning and end date of the medication. All right. And maybe a one-time dose. Your doctor only ordered you to get Percocet one time. I need to call him again. Maybe he wants you to have something not as strong. So all of that's the right drug. All right. So that's number 2. And then the right dose. So you're verifying your dosage calculation. All right. The drug is safe for the patient. And I can get really nitpicky in, but I'll just give you an example of, let's say somebody's on dialysis. Well, their dosage, and when I'm giving somebody something that's a dialysis patient, I call the pharmacist. I said, I have somebody on dialysis. I want to give them ceftriaxone. What is the kidney dosage? What is the nephrology dosage? Because their kidneys are not working properly, and it's just going to sit there until they get dialyzed on Wednesday. It's still going to be effective for their level that they are, or a pediatric, let's say pediatric. I'm not going to give somebody a pediatric, uh, a dosage for adult, that's for pediatric, stuff like that. There are some medications that you have to weigh them on. Let's just say I remember when I was in nursing and the med surgeon, the way people for LASIX. I don't know what they're doing now, but if it needs a weight, you have to get the weight and document. That's going to be part of your documentation. And always, 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 always verify the doses of certain medications. And heparin and insulin, I have had my heparin and insulin verified since 1994. You're going to look at it, I'm going to look at it, and you're going to look at it. If I'm going down, we're going down. Because that is something that if you give somebody the incorrect dosage, you could kill them. And we're not trying to do that. No pressure. All right. Right time. And so this is really, some places I work give you a 2-hour window. If something's due at 8, you can give it at 6 or 10 and consider being on time. Just know your policy. Don't micromanage it. They'll let you know. Always learn your military time if you don't know it. 1400 is 2 p.m. 0200 is 2 o'clock in the morning. I write in military time so that nobody can be confused if my P looks like a P or my M or looks like an A and they give it at the wrong time. Jennifer didn't write correctly. So do military. There are medications that are affected by food. It'll state that on there. There are drugs that you give with food, without. Just read the label. It will tell you. Ibuprofen you take with food or it will tear up your stomach. It won't kill you. You might wish, but it's going to irritate you. So that's part of your education and teaching. Get some crackers for the patient or whatever. Check your expiration dates. Antibiotics always have an interval, means they're given at a certain time. So all of this is part of the time. And so when you start giving medications more frequently, you'll know ibuprofens with food. You'll know that, and you'll automatically, somebody's eating their dinner, I'll give it to you now, or whatever. You're not going to try to memorize and know this right off the jump, but just know that's part of the right time and then the right route. That's probably the one of the easiest ones to kind of remember. If it's oral, it's oral. If it's in your eye, it's in your eye. If it's in your sub-Q, subdermal, that sort of thing. Um, if it's this is a I think it's very important to know there are medications it'll say don't crush it. Do not crush it. I don't care if they ask you to crush it. It's not going to work. If it's enteric-coated, it's enteric-coated for a reason. You're not supposed to crush it. It's going to deactivate however the pharmacological company designed it. It ain't going to work. Whatever you want to do when you leave the hospital, if you want to crush it, it's your business. I'm telling you now, I'll ask the doctor to prescribe maybe a different way of giving it to you, but I cannot crush this. It's not going to do your body any justice. And I'm trying to help you. That's how I usually explain it. But anyway, offer them water or juice if need be, and if it can be taken. There's a lot of like little asterisks. You'll learn this. Certain medications you're not supposed to give with this, that, or the other. But just know that for practical purposes, if someone tells you, you know, can I just put that pill under my tongue? This is not ordered sublingual, it's oral. And however it's designed is how it's going to work. So, so you want to document. If you didn't document, it wasn't done. That's one of the things you'll learn in nursing. I think they still say that. You can say, oh, I gave her some Percocet at 2 o'clock. I forgot to write down. Well, you didn't give it to her. So we have a problem. Record the drug, name, dose, route, time, like your 5 rights. Sign it. People don't sign their stuff or legible, but I want to get into all that. But part of your documentation, as soon as you give the medication, the first thing it says on the slide is you're going to record it. Somebody's going to pull you in another direction and you've got to document. I think you can document in the room. That's what I would do. If I give somebody that medicine, I will do not leave that room until you document that because you go out that room, somebody's going to want something from you. So now we're going to kind of switch into the just and safe culture because we want to be safe nurses. We want to be safe. We want to keep our patients safe. I will address questions at the end. I see I have some questions here. Hold on to your question. Let me get through this. So this slide is all about drug reconciliation. And whenever you go into a doctor's office, they ask you what you're on, what you're taking. I have them tell me. If I have a list, I want to know what you're taking, how much you're taking, when you're taking it. And I just let them talk. I just let people talk. I don't seem like I'm not going to interrogate you. I know what my sheet says and I know what I gave you. And a lot of things can be solved because, that's why your sugar's up. You're not taking your metformin right. That's not how I wrote it down for you. What did you do with what I gave you? So you want to reconciliate because you want to make sure as a provider, I need to know what you're taking so I don't give you something similar in that class or something like that, or I give you more of another medication that causes you to be sleepy or something. I need to know so I can formulate. So as a nurse, you're helping your provider and your patient, like they're taking this for this, that, or the other, so that when I decide what I'm going to do, I need to know all of that information. But anyway, so always, it's great, especially if you have chronic conditions. I don't need to know that you have a current list of your medications because all your different providers are going to ask you and you can just hand it to them, tell them to make a copy of it. I love it when people come in with an updated list. What's the date? When was this updated? Is this current? I'll still go over it, but it just makes it quicker and smoother and what have you. Cross out what you're not taking, all of that kind of stuff. So that's part of your responsibility as a nurse because you're keeping them safe by making sure that somebody's not over prescribing or, well, you can't make sure that, but it helps with the process. And bring it to the appointment. Or I tell them, just put it in a Walmart bag, bring it in. I can read, I can write it down. If you don't have time, I can just bring it in. Did I click the button? Hang on. My button don't want to click. Okay. And I'm not going to spend a lot of time on this slide. There's a proper way to get rid of medication and it's not putting it in your trash can. So the simple thing, I wouldn't harp on this slide, is that if there are places that you can take your medication to, if you don't want to fool with it yourself. Like one of the things here that I've never done before, but I'm like, that's one way is that if you dispose of it into like kitty litter and people go through trash cans. That's one way to make sure somebody doesn't pull it out. But there's a correct way of getting rid of their medications. So all of this again is you as a nurse. If you don't spend your time doing medication, you're educating because you're trying to keep your folks safe. And couple of different folks I have in my pocket. I have a couple of pharmacists I can call for anything. I'm like, look, I'm stumped. I want to do this, 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 and this. They're taking this, 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 and this because they're doctors of pharmacy, which means they know the medications better than any doctor, any provider. So, what you think I should do? This one? Okay. And then social workers. Love my social workers. Um, anyway, I digressed. So, um, OSHA, the Occupational Safety and Health Administration, they're at every organization. There's someone that is making sure that you, the nurses, the staff, the medical folks have everything that they need. The employers are keeping their people safe. All right. They have the right equipment that they need. They have the right goggles that they need. The workplace is safe and secure. You have educational opportunities. They're the federal agency. I don't know if you need to know all of that, but like if there's something an employer needs to know, like all of the needle stick policies come from OSHA. They're like the CDC for workplace, keeping the employees safe. So they are required by federal law to make sure that they have things in place for the employees. All right, so that's that. Um, and sharp safety is part of that. Anyway, so another thing to keep in mind as well, there's proper ways of doing things. Examples of safety risk. Risk means do not tablet splitting. Some tablets are not meant to be split. If if it's not scored, if there's no line down the middle, you ain't supposed to break it. I don't care if you put it in a pill cutter and break it. You're not most supposed to break it. You're supposed to swallow it whole. You're not supposed to open up the capsule. There's a reason why it's in a capsule. You want to be respectful with that because people, if they have to pay for their medicines, they're like, I couldn't afford it. I just broke it in half. I hear you. Why don't we do this, this, and this? Because when you cut it in half, it's not going to work the way it's supposed to. It's designed to be swallowed whole. If there's a line in it, that means that's exactly where you're supposed to split it in half at that line. Not on the left, not on the right. That's why the line is there. Buying drugs off the internet, people trying to, I'm not saying one way or the other, but you need to have it prescribed by someone here to know its authenticity. That's all I'm going to say on that. There's a lot of counterfeit stuff out there, so be careful. Um, I think I kind of went into that, to crush or not to crush. You, again, you want to always call the pharmacist. You can always, again, but you will know, it will say if you can crush it or not, but I will always call someone if I have a question. Um, you don't crush extended or sustained release. It's meant to, again, how it was designed, it's meant to be swallowed whole and it will activate inside its body on a slow release system. And by you crushing it, you're just messing up the design of how it's supposed to be released. They might get it like a bolus. I don't know. But anyway, so if it says don't crush it, don't crush it. Um, and then again, like high alert medications, you're not going to know everything right off the bat, and give yourself time and grace. But there are medications that they may be labeled in a certain way, like high alert or something. Don't be scared or nervous, but a perfect example is insulin. People don't, I'm not afraid of insulin, but you have to make sure that you are aware of certain medications that you give. You can't just stop it back out. So um, it can cause lethal things, death. Um, and so certain medications people have limited access to, or they make sure that you have it verified. It's not like it's not given. We give insulin all the time, but you always want to have it you want to have somebody verify it. And then I'll say, in Marlet, just because your face is underneath mine, insulin 5 units given, verified by Marlet RN. We're going down together. And we're going to be wearing stripes together. But no, I can wear the stripes. I've never had an issue. So again, meds that look alike sound alike. One of the perfect ones because Depo Medrol is Depo shot, and then you have Medrol, which is a steroid medication. Usually it's given for people that have like COPD or for your lungs, but it's a steroid. Look alike, sound alike. Just be aware of that. Um, Continuing on is that never distract the nurse when she's giving medication. That's why if you're giving it in the room and you're able to document it, just complete the process. Give the medication, document it. You can always add on an addendum later, but gave this medication this time, the period, it's done. Because if you walk away or somebody comes in, that's how errors occur. And it's just, don't ever interrupt. If you want something from somebody, you want somebody to check your insulin and they're in the middle of doing something, find somebody that's not busy because now you're throwing off their thought process. So, okie dokie. And then there are reporting systems in place that you're supposed to report things to you. I would say report to your supervisor, but I don't want to make this a but there are resources for preventing errors. And I will always say this, go through your 5 rights, document as soon as possible before you leave the room, if possible. Have somebody check something if you just don't know. Call people, ask questions, and research and learn your meds. If you give something like every day, try to learn more about that medication. So just because you stop school, you want to like know all you can. If you're working cardiology, you want to know more about that cardiac medicine than I do. I'm in OB gynecology, but I know a lot about OB gynecology meds. Do not bring me no cardiology meds. I can't help you. So, but I know who can. And then again, safety, 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 safety. When they're talking about they talk about in the chapters, they talk about recognizing cues, analyzing cues. So when you recognize, it's like you are aware, you observe you with your eyeballs something. All right. You're using your critical thinking skills to determine if a medication is safe to administer. Okay. So you're looking at something, you're observing, you're processing. All right. Then you're analyzing information that you saw. So that's the analyzing. So you have to recognize it. You have to be cognizant and aware of it. Then you have to analyze it. This is all part of safety, critical thinking. You're like, I don't think they understand why I'm giving this to them. I need to educate them more because they're going to go home on this medication. Prioritizing means that on any given day, and you'll quickly learn to do this or not, take your time. When we do our team huddles, so I'll probably see like 20, 22 people a day. In my mind, I'm already like recognizing cues, analyzing cues. I had a patient that came in today with heavy vaginal bleeding, heavy periods for months. And so I'm doing her exam. I'm about to go in and do exam. And then my MA comes out and says she's dizzy. I'm like, tell her to put her clothes on, go to the lab, give me a quick CBC, have her come back and undress, talking to her labs come back that her hemoglobin's 5. I'm like, you got to go to the hospital. Oh, I took an Uber. Oh, I'm calling an ambulance. We're not putting you in a car. Well, I feel fine. Well, you're not. You're dizzy for a reason. So, um, my spider senses start tingling as soon as they start talking about giving me report. I'm like, I got to do this, make sure she's not pregnant, this. But it takes time. So I'm recognizing cues, I'm analyzing, I'm hypothesizing. Okay, so I'm like, if you're dizzy for a reason. So I need some type of lab work to tell me what I'm dealing with before I even touch you. Then you go back in the room, and then I do my generate my solutions. Uh, and all of this happens relative. I mean, you got 20 minutes to see somebody, but okay. So you'll calculate your doses correctly and verify if need be. Do not distract anybody when they're doing their meds. It's borderline, not rude, but just don't do that. All right. So again, taking action. I have a resource that I go to when I'm looking up to see if a medication is going to interact with their breastfeeding. You're not, when you're done with school, you're not going to stop learning. Okay. There are certain sites that I like, certain places I like to get my information from. I like my CDC stuff. I like my perinatologies. I have a perinatology site where I can put in calculation with their due date and it'll tell me this is when they need their glucose test. This is when they need. So you'll find that. So start having good reputable sources and certain things you need to do. You need to wash your hands before you give somebody before and after giving drugs. Never ever administer something that somebody else has drawn up. I don't care if they're your bestest friend and y'all went to school together. I don't care. People know I am funny in my clinic. If I'm giving it, I am pulling it up. I am doing all of that. Now, my MA, she already knows me. She has the lidocaine. She'll go like this. Like, let me see it. Okay. She don't take it personal. And I'm in the room with the patient and she's drawing it up. Okay. And then she'll show me again. I'm like, uh-huh. Change the needle. Oh, I forgot. But I didn't because I'm about to give it. And now you've dulled the needle. So no, ever, 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 ever. That could be like sterile water in that vial needle. I don't know what you drew up. I don't know. And I'm giving it. So, and you always want to evaluate outcomes. Like you give somebody something for pain, was an 8, now it's a 6. Okay. So, and that's part of your documentation as well. So, critical thinking time. Y'all didn't think I was just going to talk, 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 and 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 talk. So here we go. Here's a question that I want everyone to read, and I want you to type your response in the chat box. During medication administration, how can the nurse properly confirm he or she has the right patient? I will stop talking now. Type your answer in the chat. Anybody need more time? No? Miss Hox, is it Hoxie? Did I say that right? No. Okay. I want Priscilla to unmute and give me her answer.
I said C for the first and last name and date of birth.
I want Peace to unmute and give me her answer.
I chose C. Ask the patient to state their full name along with their date of birth and compare this information to the medication administration record.
And then I would like Ms. Patel's eyeballs. That's all I see to give me her answer.
Sorry, sitting in a dark room.
That's okay.
I chose letter C to ask the patient to state their first and last name, their date of birth, and then compare it to the MAR and their wristband.
Excellent. To confirm you have the right patient, the nurse needs to use at least two identifiers. Full name, full name. If you say somebody's name, they're going to say, Jennifer, I'm like, can I have your full name and your date of birth? So, excellent. Got another one. The nurse notes in the MAR that the patient was ordered to take acetazolamide 500 milligrams. The nurse checked the medication packaging on hand and found it contained acetohexamide 500 milligrams. The nurse is assessing which rights of medication administration and what should be the next action. It's one answer. Are we good? I want to hear from Crystal. What's your answer?
I actually didn't choose. I was still reading the question, so I didn't choose the answer.
I'll come back to you. Da. I saw you on here. All right. I'm gonna have to come back to you. Marlet?
I chose C, the right medication and right dosage, and to hold the dose and notify the pharmacy.
Lindsay?
Hi, I chose C as well. Need to clarify the medication because it's different spelling, obviously a different med altogether, and to notify the pharmacist.
Are you ready, Crystal? What do you think?
I am. I'm going with C.
Let's find out. The answer is C. The nurse checked the right medication and the right dosage. Due to this safety check of the medication administration, the nurse should note that the medication on hand is not the same medication ordered. The medication names are very similar. One is a diuretic. One is used to treat diabetes and lowers blood glucose. Fabulous. You received a new medication order for a patient with glaucoma. The patient has no other health history and is allergic to penicillin. The order says to administer timolol, 0.251 GTT drop twice a day. Your next action is to oops, sorry, my bad. Are we good? Priscilla, you want to tell me something? Miss Diaz? Oh, Miss Diaz, you've already answered. I apologize. Let me hear from everybody's like, don't know me, not me. Who hasn't answered? Let me just go there. Somebody unmute. Go for it. I need 3 people.
I chose C as the answer, hold the order until you can obtain an order clarification from the prescribing physician because there isn't a right route in the order.
I like that critical thinking. Give me somebody else.
I also said C, to hold the order until you can obtain an order clarification from the prescribing physician.
And I said C as well, just for the same reason.
The order the nurse received is incomplete. When assessing the medication administration right, the nurse will note that the order fails to specify the route. I don't know if it's the left eye. I don't know if it's the right eye. I don't know, but both as. The nurse needs an order clarification before continuing.